Welcome to Tech Tuesday. My name is Abby Ritchie. I'm the CEO and founder of Senior Savvy, and you can find me right here every Tuesday talking with people who are engaged in age tech innovation and helping the older adults in our lives. Today, we've got a great guest lined up for you, but before we get started, let's go ahead and run our intro. I want to go ahead and bring our guest on. We have with us today Dr. Craig Zimmerman of Laser Tech. Welcome to Tech Tuesday.
Thank you for having me.
Yeah, my pleasure. My pleasure. So, I met Dr. Zimmerman in person a couple of weeks ago, and it really struck me because I know this from working with older adults around the country, how many people are struggling with chronic pain and how debilitating it is, and also what a struggle it is, and it could be such a bully. Before we launch into that, Dr. Zimmerman, could you tell our guests a little bit about what you do at Laser Tech, please?
Well, I've been in the pain relieving field for over 30 years. The first half of that was focused on acute pain. The last half, and presently, I run Laser Tech Pain and Back Relief Center in Scottsdale, Arizona. I am certified in physical medicine modalities. I am a chiropractic physician, but I am focused on medical technologies that get to the root cause of pain. So that's what my focus has been, trying to figure out how to get people better when nothing else is working.
Yeah, that's so necessary. So tell us, what is the usual process in which someone eventually comes to see you? What happens leading up to that?
Well, most people that I see have pretty long history of pain, and once it goes past 6 months, it's really well into the chronic pain syndrome. Most of them have tried many of the traditional treatments. If that works for you, of course, that's fantastic. But unfortunately, most have tried injections, pain management, physical therapy, traditional chiropractic, and many of them get pretty frustrated because they're told oftentimes that, hey, they're just too old and it is just what it is. You got to live with it. And I just don't believe that's the case. I used to be an athlete. I had chronic pain from those things. The acute pain treatments that I didn't work for me. And I had to figure out how to better handle chronic pain. Chronic pain is different than acute pain. And so they come to me after trying pretty much everything. And the good news is if you go after it appropriately, you can make some pretty good changes, especially taking advantage of some really great technologies.
100%. So, the way I've come across this for myself and also for my students is a lot of times, I will hear, maybe I'm working with someone one-on-one, and then I hear how much pain they're in. And that hurts me. And as I'm sure it hurts you too. And besides the fact of arthritis and other limitations as we age, but to have this type of crippling pain on you all the time is just so debilitating. Is there any study or research or anything that says like how many years that could take off your life or remove you from a quality of life?
Yeah, I mean, over 50 million Americans are suffering with chronic pain, and it's been very difficult for them. Some of the studies do say that your brain actually shrinks due to chronic pain, so that's not a good thing as we get older.
Yeah.
And also, there's been some studies that up to 7 years of less quality of life, but also time around. So you can lose some years of your life just because of chronic pain. Yes.
Got it. Got it. And so typically prior to people coming to see you, they've done injections, they've done surgeries, they've done chiropractic care, physical therapy, and then after that, they come and see you, right?
Correct. Yeah, they come to me after trying everything. It makes sense to try everything you can that's within the traditional realms. But the thing that I've learned back in 2005, as I said earlier, I had chronic pain and nothing was working for me, and I was in the acute pain business. My mom had back problems. She had 3 surgeries that didn't work. So I really was in this failure situation for chronic pain. And I really felt embarrassed because I was a doctor and I couldn't help myself. And so I really wanted in 2005 to really put some time and look into chronic pain. And I believe what is really a difficult with the existing management process is that they're focused on what I call isolation treatments, where they might have a great way to work on inflammation or to stop pain. But over the years, the studies have shown that chronic pain is multiple causes, not just one. So the analogy is like instead of a key lock to unlock your pain, it's really more like a combination lock where there's multiple things involved and you have to deal with all of them concurrently. And that's what we found is more effective or been most effective for our patients who have tried everything. And that's why they come to me, because we give them a different solution, one that's been very successful.
Excellent. So let's talk about that solution. You're using technology to help solve chronic pain. Let's talk about the use of lasers to improve your body's circulation, the nerve circulation, promoting nerve in the surrounding tissue area. How are lasers supporting those efforts?
Well, most technology is based on applied science. And so the first thing to understand is chronic pain oftentimes is due to some residual damage or irritation that never really healed. So, and most traditional treatment does nothing to get tissues to heal. In fact, stuff like steroids and other types of treatments might slow down those processes. So I realized that we really need to go after the damage or insult or irritation. And I tried different things like stem cells and platelet-rich plasmas. And for my senior patients, what we found worked best for us that was totally non-invasive was our lasers. Our lasers are a healing technology. The analogy is like sunlight to plants. Sunlight is photons. Photons cause photosynthesis in a plant that gives energies for cell to do work, and it gets a not so healthy plant to become more healthy, give it a little bit of nutrition, and it's pretty healthy and living and thriving. For our neuromusculoskeletal tissues, which are involved in chronic pain, lasers are actually different wavelengths, but they are also photons. These photons have been found through science, through technology, to work on mitochondria of the cells. And the mitochondria is where we get our energy for our cells to do work. And so we can stimulate and increase and accelerate healing by significant amounts. And the nice thing about it is age is not really the issue here. In fact, as we age, all degenerative disease is linked to mitochondria. And the fact that our lasers work on mitochondria has allowed us to help 99-year-old men and women all day long. So we're really proud of that. And that's why we love lasers, because we can get to the healing of damaged tissues in a non-invasive way, in a very safe way.
So tell us, because when you start talking about lasers, I'm getting pictures of like red lights being shot at something. Can you set this up for us a little more of like, what does this look like practically when someone starts to receive laser treatment in your office?
The lasers that we use are computerized. There are multiple wavelengths. Science has shown that certain levels, red laser light and infrared laser light have better work together, and therefore we can get to more cells and get a better reaction. So we use an array with multiple lasers. We also use other lasers to get deeper. And our whole goal, we just put it on you. It's got to be on the skin. It's not like we're shooting stuff at you. It's put on you like any other therapy. And it gets absorbed. And we use what's called a layered absorption process, which means we go from superficial to deeper and slowly but surely work to get it to penetrate and saturate your tissues, because that's necessary. But it's really, and I know laser sounds like a little scary, but the way we do it is like another technology put on you. In over 40 years, there's been zero downside to this. They can't burn you. They can't hurt you. They can be put over metal implants, so there's no problems there. It's very passive, but one of the most powerful things I've seen if you want to finally get to the root cause of this damage and irritation problem.
Yeah, absolutely. And why don't more people know about this?
Well, I think a lot of people know about it. I think lasers are all over the place for different things. You see lasers for
Eye
eyes.
surgery.
Yep,
Yeah.
eyes.
Mhm.
You see lasers for hair growth. Uh, Unfortunately, my view, and I make sure I say it that way, but
Okay.
like I said, technology is something that's based on applied science. And unfortunately, in my opinion, our doctors get stuck in the past of the old science. And it's really hard, by the way, any of your listeners, it's hard to learn new technology because it's different to us. And so I can't fault them for it. They're kind of stuck in that way. But science changes, technology changes. Look at all your technology you're getting at home. It's changing every day, different
Mhm.
ways. And so, unfortunately, what's not happening is our doctors and therapists reaching out for that new science. They're not doing it. And my experience has been, if I want to get to the causes and I want to make a significant difference, I really need that advantage of these technologies. And if I want to do it non-invasively. So obviously, I've opened up my eyes to the technology because I've seen the benefits, but some people just are stuck in their old science that go after pain, go after inflammation only. And that's what they do, even for chronic pain. And it's just not working. There's multiple causes. We've got to have technology to give us some better advances to help these seniors who are struggling so much, because they deserve a quality of life and they can get one. It doesn't matter how old you are necessarily.
Right.
Don't get me wrong. Your body changes as you get older, but that shouldn't be what stops you from trying to get better, because you really can. We just need to go
Mhm.
after it appropriately. And these technologies help my patients dramatically.
Excellent. So I want to talk about some of the success stories that you've had, especially around certain conditions and certain pain areas like sciatica or neuropathy and or arthritis or spinal decompression, things that typically are causing older adults the most amount of pain.
Our older adults, first of all, back pain is the number one lifestyle problem you're ever going to have. And unfortunately, uh, pain management and surgery have been failing to, of course, if it's necessary, you got to do what you got to do. Don't get me wrong. But it hasn't been lowering the number of people suffering chronic pain. So we have to look at alternatives to that. So stenosis, spinal stenosis, which is narrowing from degeneration of the spine, and it basically jams your facet joints in the posterior or back part of your spine, and it also the hole where your nerves come through of called your foramina becomes smaller due to that. So you can most of those cases when you get older is going to be stenosis, which means pain with standing and walking typically,
Mhm.
and typically sitting actually feels better. Now, that's not always the case, but that's pretty close to what we see a lot of for our seniors. And not being able to walk is a big problem, as we know. And you want to go out and
Yeah.
enjoy the fairs and festivals. It's winter time here in Arizona, so you want to get out. So surgery is not really, as you get older, a little bit more concerning, more
Yeah.
invasive. And so what we do have is something called non-surgical spinal traction decompression. And we can angle right to a level based on an X-ray or an MRI, and we can actually get that space to open up enough to take the pressure off the joints and the pressure off the nerves. When they do surgery, it creates scar tissue. There's a lot of
Yeah.
potential issues with surgery, but all they're doing is opening up about 2 millimeters of space. There's not a whole lot of space in there. I can do it with this technology that gently opens up space. That's very easy, very comfortable, and we've been able to save a lot of people from surgeries, even if they've been
Yeah.
told they have no choice but to do surgery. So it's a great technology for that spinal stenosis, which is a typical condition for the spine, and maybe even sciatica shooting down your legs as we get older. It's something that we see very prevalent.
So, around how many laser treatments would someone struggling with sciatica need?
So I believe in integration of multiple technologies, and I think that's
Mhm.
where I've been able to help many people when other things haven't happened. So when it comes to treatment, I do a free consultation. I try to figure out the exact causes of a problem, because sciatica could be due to a disc problem. It could be due to what's called a piriformis problem. So we got to figure out where the problem is. You can't just say you got a back problem. That's too generic. We got to figure it out. So that's what I do in the consultation. And once I figure out what technologies need to be performed or are going to be the best to go after the multiple causes, then I can answer that question very clearly, because over the years, what we do is we start with a 12 treatment protocol. For chronic pain, people having it for 20 years, that's a very short time. But in 12 treatments, what we found
Yeah.
is most people with chronic pain, we can actually get change with the way we go after this by using these technologies in an integrated way. So we get the benefits of all these different things. We can get change in that short of time. And if we're not getting change in that time, why would we want to just keep treating people?
Right.
Unfortunately, people come to me and they've been doing the same thing for 20 years. That doesn't make sense to me. So
Mhm.
initially, we start off with those 12 treatments, typically done 2 to 3 times in a week. But we've been able to make a big change for most people. For sciatica, for instance, we have a machine called an ENB. It's a increased or better technology for the nerve problem because it doesn't try to numb anything. Your
Mhm.
body needs to function better. Your nerves need to function better. We have a machine that basically retrains your nerves to fire better. So if we can take care of the damage or the space problem and then get your nerve working better, we can actually start getting some benefits that are potentially more sustainable for people.
Right, because if someone has neuropathy, for instance, in their feet or in their legs, it's usually because the nerves have started to shrivel, right? And they're not getting enough oxygen-rich blood. Is that right? And then are you able to regenerate the growth of those nerves again?
So you are right in a certain way. The problem is, again, just like back pain, neuropathy isn't all the same, right? So
Mhm.
there are different causes of neuropathy. And to make it simple, when it comes to a clinical presentation, you could break it down into three types of presentation, which will dictate how you want to treat it. They're not all the same. So
Right.
that's why I have to have a lot of different technologies to allow me to address the different causes. So you have diabetic style neuropathy. Typically, that is the circulation problem that you're talking about. You can have chemotherapy that causes neuropathy. That's actually a
Mhm.
toxic style of neuropathy. And
Mhm.
you can have what's called idiopathic, which is somewhere in the middle of those. To answer your question about the nerves, yeah, the answer is nerves can heal. They can rejuvenate. They do treatments for pain management called radiofrequency ablation. And if you read
Okay.
the bottom of that form, it says, by the way, 3 to 6 months later, your nerves will grow back. And the problem with that is nothing's changed, right? And sometimes they come back a little angry. So,
Yeah.
but what's good about that? What was good about that is it taught us, it showed us, it should show everybody that nerves can grow, nerves
Yeah.
can get better. Our lasers, but we have to use different type of whether working for circulation or working more for nerve rejuvenation. So we have different levels and different types that do that better. But our nerves can regenerate; they can get better. And technology has been really successful. Again, the multiple interactive technologies, depending on the true causes.
Yeah, you mentioned that a couple times, multiple technologies. I'd love to hear more about that because when we think about lasers, we just think about one, but you have developed several. Is that right?
Well, I have several different types. They all have different settings. See, the thing is, everybody is different. So
Right.
if you treat everybody the same, give them the same prescription, the same exercises, the same therapy, it's not giving them as quality of care as maybe they could have, and maybe that's part of why we're not successful. So I want to make sure I match my treatments to the condition and to the patient. And so, yeah, I have lasers that are going to go after more circulation. I have other lasers that are going to be more for rejuvenation of nerves. But I have millions of different settings that allow me to go after different physiological attributes that might be related to those conditions. And again, we use other technologies because with neuropathy, if your nerves aren't firing right, if I can retrain them to fire better, that's a good thing. If you mentioned the circulation problem, we have technology that can increase circulation into the area by up to 30%. So there's if you take technology, it all depends on the user, right? So
Hmm.
technology is great, but just like when you work on with people to get them to better understand technology, like you're going to have to do for me, I'm not that great with with the computer, and that help is really needed for us seniors. But when it comes to technology, when it's in the medical field, you really have to go and see people who really understand how to integrate and use technologies because technology is only as good as the user. And if you've got to be going after something that's real, something that's tangible. So that's why I have multiple. The equation for chronic pain is different than acute pain. Chronic pain is multiple causes. So basically X plus Y plus Z equals your pain. So there's 3 or 4 or 5 things. That's what research has shown. And so you have to go after all of them or your pain's still coming back. And so that's why I've developed a multiple cause approach. I know I've written a book on this, as you know, called Unlocking the Chronic Pain Code. And it really talks about, instead of a key lock, it's more like a combination code lock. And so I use technologies that are best suited to go after each of those causes. And it's been proven and shown through research that chronic pain is different. It is multiple causes. And if you don't go after them all, then you're probably going to have a more difficult time helping people. So these technologies has just been amazing. And you know how technology helps people. But in the
Mhm.
medical field, there's been technology that's been great for a lot of different things. For chronic pain, these technologies have really just made a big difference. And we're helping so many people based on not only the technology we have, but because we're using them to go after key causes of their problem.
Yeah, yeah, it's so smart, so smart. So I want to know from you, if you could design anything else right now to help your patients, what would you design?
I would, I would love to have it go to where there's a technology that covers every part of the causes of pain, but that's going to
Yeah.
be very difficult. I have to have so many different ones. Um,
Mhm.
Anything that's going to improve mitochondria is going to help us seniors. It's really a big deal. I would love to have a technology that would get into the joint and actually get it to heal back to 20 again. There's no such thing. I would love to see something like that. We can get cartilage to heal. We can get
Mhm.
you functional again. It doesn't matter if you're bone on bone, depending actually on how you present. But if you have pretty good motion, you're likely to be able to get relief without surgeries. I would love to see something though that can actually get that back to a 20-year-old again. But to be 70 or 80 and have all that knowledge and all that experience and still be able to get that function back and live your life, that's what we can expect right now, and that's what we've been trying to do at my practice.
Excellent, excellent. So tell us, who else is doing this? Who else do you follow? How else are you motivated and inspired to come up with some new solutions?
So when I first started looking into this in 2005 or so, when I had chronic pain and nothing was working, I decided to kind of look at the way our doctors and other doctors were going after pain.
Mhm.
So I started looking at the quote American way or Western world way or just the American way, what we did in the United States. And it seemed like it mostly went after pain or inflammation. It was really going after individual things. And so many of my patients come in, and maybe some of your viewers have been told this, that, hey, you just have to live with it. There's nothing you can do once you try your pain management, physical therapy, chiropractic, those kinds of things. And I started then deciding, let's look at different parts of the world and see what they're doing, see if they're having better successes. And what I found through my research was Europe was a little bit more progressive than we are when it comes to lifestyle. I think we'd say that our emergency care in America is amazing, and our doctors are doing a great job. There's nothing to say; they're doing great. But when it comes to lifestyle, maybe they have a hand up on us in Europe. At least they're more focused on that. They're more interested in lifestyle than they are anything else. So I started looking to what they did in Europe, and I started seeing them going after causes and using technologies. And so I started following those people, the scientists like Tina Carew in Russia, who's really a strong advocate of lasers, Germany, Israel, Canada, different places in the world. Really, we're focusing on causes. We're talking about technologies. We're actually saying, yes, you can get better. No, you don't have to live with it. And the key was basically going after the causes and probably going after technology. For instance, in Italy, they developed a whole new wing in their medical in Milan in their medical school to go with technology. They were able to see that you don't want to stop inflammation because you need inflammation to heal, but you want to regulate it. So they developed products that allow us to actually use homeopathics, which is safe and non-invasive, usually able to be used when people have other different types of medications, even other health issues. And we can regulate the inflammation by these low dose cytokines. And so it's just a better way, and they're finding better ways, trying to look at solutions and improving conditions instead of just symptoms. And so Europe has been where I go, and all the scientists involved in that and other technologies.
Great, great to know. Well, doctor, as we wrap up today, is there anything else you wanted to share with our viewers about laser tech for chronic pain?
Well, I think the most important thing I can say to your viewers is you can get better if you have pain. Don't accept that you have to live with it.
Yeah.
Always try to get better. Always have that drive. You got to be the advocate for yourself in all ways, not just in your health. Obviously, if you're interested in what we do a free consultation. You can always come and talk to us. We're here to help you. But if you have chronic pain, it is a different beast. You can't usually get the results you want through traditional treatments because it's just not enough. And so
Yeah.
I hope you've learned that it's complicated. You have to go after it differently. And I hope that you'll open your eyes to that and look for solutions for yourself. And again, if I can be help to you, my pleasure. But you really deserve it. You have so much to offer us. I love talking to people who are 70, 80, 90 years old. They have
Mhm.
so much to offer people. You guys are really important to us in the world. And I hope you have that drive to live and enjoy and live an active life and bring all your pleasures and all your
Yeah.
wisdom to us. So I hope that that makes some sense. But I wish you the very best. And thank you so much for listening today. I appreciate it very much.
Yeah. Likewise, likewise. So, and how could people get in touch with you to find out more?
The best way to reach me is through my website. There's a lot of great information there, lasertechaz.com. You can look up LaserTech Pain and Back Relief in Scottsdale and give us a phone call. But the easiest and best way for you to learn really whether we can help you or not is to come in for that free consultation. I'm a pretty straight shooter. I don't play games. I'm here to help and serve people, not just to
Yeah.
treat people. So if you're open to that, I'm here for you, and I'll do my best to give you the best information I possibly can.
Excellent. Excellent. Thank you so much for joining us today. I have learned so much and so much more that I could share with my students. I hate to see anybody in pain and to be suffering. So thank you for aligning your mission here. And we'd love to have you back sometime. And for those of you who are joining us, we thank you for your participation today. We hope you also got a lot out of this, and we will see you back here next week.